Well, good afternoon, everyone. It's Pete here from the Pain Toolkit, and I'm just getting in the hang of doing this, going live on YouTube. I think I'm going to be doing lots more of it. But I've got a question I need to ask you, really, and that's a bit of a question I've been asking myself over the last several weeks, months, even that listen, our NHS and other healthcare systems around the world are all struggling for one reason or another. And what I don't see any direction from the Department of Health here in the UK promoting more self-management within primary care, even in secondary care, really. I did a bit of research this afternoon to find out how many people live in the UK with long-term conditions, and this info goes back to January 2018, and it says there are over 26 million people live in the UK who live with at least one long-term condition, and 10 million who have two or more healthcare conditions. So, I'm guessing that that number's even more now. I mean, that's quite old information, and but I don't see any direction really. I mean, I see little pockets of self-management stuff going on. We're trying to do our best here in Pain Toolkit land, by starting up a new website, self-management website. I've got Scott, the Pain Toolkit website guru, to build one last year. Is it used going by analytics and stuff like that? It's not, and I've done my best to sort of promote it with which way I can, but it's a resource for people living with long-term conditions and also healthcare professionals who support them, and that's what. Listen, self-management is about doing stuff, and this is things I've had to learn over the years. I've got several health conditions, as you know. I won't go into them in detail, but I've lived with asthma for best part of most of my life, really, and in the last 20 odd years, living with long-term pain, and in recent years, prostate cancer. The thing is, it's you get these diagnoses and stuff like that, and but I'm now, because I'm really into self-management, I'm always looking for other ways that I can do. What can I do even better to self-manage my health conditions? Listen, I don't want to me, I want to stay upright. I want to stay above ground and stay upright and have a fulfilling life. But the only self-management is a doing thing, and I think we need to impress on people. It's not like a magic fairy dust that sprinkle over someone and hey, oh, that's it, you sorted. It's a doing thing, and I have to set aside times during the day for doing meaningful movement or purposeful movement. I learned that this week. I was teaching the physio students over there in Ireland via Zoom, obviously, and RA Do was one of the lecturers there. I was talking about meaningful movement, and she said, "Well, we call it purposeful movement." And I thought, "Yeah, I'll dig in it. That's really cool." So, I probably swift it over now and go from meaningful movement to purposeful movement. But where's the direction coming from? I listen to the TV stuff and whatnot on the radio, and I just don't see any direction from the healthcare ministers over the years. It's all about we providing this, doing that, da 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 da. But at the end of the day, what about we? I tweeted the NHS this afternoon. Those and what all the things that they provide in the surgeries, and I suggested, what about having like train up nurses, nurses there, or get some coaches on, where they can coach the patients who are living with long-term conditions, what they can do for themselves, And listen, I'm just one bloke trying to just spread the word, really. And but I want to put it out there to you. I mean, what's going wrong? Why aren't we? Why isn't there any action taken? We seem to be, as I say, there's pockets of self-management here and there, like, and some really good stuff going on, throughout the UK. But I just don't. There's that. We need that extra push from the as I learned when I worked in the NHS years ago in the expert patients program. We was told that the Department of Health create the policies and the NHS has, delivers it. But I don't see any direction from the Department of Health, the health ministers, and for social health and social care. I just don't see any direction from them. They just, whatever, listen, we have to deal with what we got, like, whether I'm not going to get into too political, etc. Because, well, I can't do that. I don't want to really get into that. But that's another story. So I want to hear from you. What do you think we need to be doing? What could we do extra to get that self-management message out there? Listen, if you want to save our NHS, if you want to reduce, reduce the numbers that ended up in A&E, was an unplanned admission or whatever. People, we need to be encouraging more. What can they do for themselves? Like, in other words, we need to make more self-management a bit more fun as well. Like, I don't see it as though it's like another chore to do. That's what I try and do. I have a bit of fun, with self-management, etc. Because it can be a bit boring sometimes when you've got to do some, movement. Like I do my yoga in the morning, and I bomb down the gym and go down there and do some more stuff down there. But I'm always doing me bits and bobs during the day, resting and stretching and stuff like that, bit of work, and on the whole, I'm enjoying myself, So don't see self-management as like a day to door, another chore we've got to do. Build some fun stuff into it as well. Hey, listen, we're always running workshops here. We've got some really good, exciting stuff coming up. We're going to be launching it at the end of the year, and also stuff in 2024, which is very close by. Anyway, thanks for watching. Thanks for listening, and I'll see you again on another live. Listen, before I go, just tell me what sort of stuff do you want me to do? Do you want me to do some question and answer stuff? If you're really digging into that, just send me. Let me know what you want to do some live stuff on. I think Katie Napton, she sort of suggested that I'll do some live question and answer. So if you think that'll be useful, help you along the way, etc., then just leave a message on the underneath this video, and we'll see what we can do. Take care. Be cool and groovy. See you soon. Ciao.